teams that are, destined to, or seem destined to win the whole thing, when they get back home, they're really tense and they don't perform. They don't score as much as they do on the road. What do you think of that?
I think that happens. Sometimes there's this kind of pressure on you. You're in the home crowd. You're the favorite, and you're supposed to, perform at a certain level. And there is this sort of extra pressure, and support and pressure at the same time. I've seen it happen a bunch of times, and then I've seen the reverse too happen.
Right.
Especially when a team has to make a comeback in their home. That's quite can be sort of helpful. But yes, I guess it's just human nature. There's all this psychology, and who's the most relaxed and focused at that. And there's going to be things that are going to happen that are going to be surprising for both teams. And that's sort of the beauty of sports, and also the pain that you go through when you're a fan watching it. But yes, I have seen that. Yeah.
John, real quick here, ticket prices, they're through the roof almost.
Yeah, I mean, I'm a season ticket holder. I share my seats. It's a little sad in some ways. It would be nice if there was sort of a section, that's affordable, for the real fans. I guess there's so many people, with dough here, that they can, people are doing it, and people are selling their tickets too, the tickets that they bought, and to make money. And so it's a little, I've always been very appreciative when I had just a couple of dollars and I was able to go see, a game or a play or whatever. But everything is so expensive now, and sometimes you're not with the real fans. The higher you go, the wilder it is, and that is the truth.
Right.
So, but like Josh Hart spoke about that, and yeah, it's a little, you go into a game, but it's, I guess some people just want to be there, but they have.
John, we'll have to let you go here.
Okay.
We'll have to let you go and come back and see us again after games 3 or maybe 4. That's actor and big-time Knicks fan John Turturro. John, as always, thank you. Go Knicks.
Go Knicks. Okay, thanks. Have a good day. All right. Take care. Bye-bye.
WNYC supporters include FX's The Lowdown, starring Ethan Hawke. The series follows the comedic exploits of Lee Rayburn, a self-proclaimed Tulsa truth historian on a mission to expose the city's hidden rot. Emmy eligible, now streaming on Hulu.
Sponsoring WNYC means reaching informed, engaged listeners who love New York. Introduce them to your local business or your next event. Find out how at sponsorship.wnyc.org.
Marketplace Morning Report is coming up next, and then in 10 minutes at 9 o'clock, it's the BBC NewsHour on WNYC. Let's check in with London and see what they're working on. Hello, London.
Good morning, WNYC. I'm Rebecca Kesby, and on today's NewsHour, is the relationship between Trump and Netanyahu as strong as it was amid new airstrikes, the Philippines hit by an earthquake and tsunamis, and Da Vinci's writings and drawings reunited for the first time in 400 years? That's BBC NewsHour coming up at 9 on WNYC.
Upper 60s now with some sunshine and some clouds out there, mostly sunny. A high of in the 70, right at 77 in the city. Tomorrow sunny and 81.
What the rural healthcare crisis looks like in one Alabama town.
Marketplace Morning Report is supported by Schwab. At Schwab, investors get choices ranging from self-directed investing to full-service wealth management all in one place. Learn more at schwab.com.
From Marketplace, I'm Kimberly Adams. We'll get to Alabama in a moment, but first, a quick check of the numbers. The FTSE in London is up almost 14 points. Dow, S&P, and NASDAQ futures are also up, with the Dow futures up about 165 points. Oil prices spiked earlier this morning, but have since retreated a bit, with Brent crude now trading at almost $92 a barrel after Israel and Iran escalated their conflict, trading strikes on regional targets. According to the Center for Healthcare Quality and Payment Reform, there are about 700 hospitals at risk of closure in rural communities around the U.S. 25 of those hospitals are in Alabama, a state already familiar with that risk and what happens to a community when it becomes reality.
So this is wild. There's still the paper on the exam chair. It's almost as if we're walking through just early in the morning before it's about to open.
This is the Thomasville Regional Medical Center, or perhaps we should say was, because right now the bright reception areas, brand new surgery facilities, and the only in-house MRI machine for dozens of miles are all empty.
Good morning, Mr. Mayor. Nice to meet you.
Nice to meet you.
Thank you so much for meeting us today. I appreciate it.
Sheldon Day, the mayor of Thomasville, is our tour guide. We're about an hour and a half north of Mobile in Alabama's 7th Congressional District, an area with some of the lowest life expectancies in the entire country, which is why Day says Thomasville needs its hospital.
We have a primary care clinic here with all the bells and whistles. We were the only hospital in the region that did 3D digital mammograms. The only thing you're missing is patients.
The medical center closed in 2024, less than 5 years after it opened. The COVID-19 pandemic was a major factor. Like so many hospitals around the country, Thomasville Regional shut down elective and non-essential care, which the mayor says made up something like 75% of the patient volume here. But when the hospital was open, there were also patients like this one.
We had a young lady who had a heart condition. Basically, one of her aorta tore, and they brought her here. Any other hospital would not have been able to see what we saw, but because of our advanced diagnostics, they had a surgery team waiting on her as soon as she got to a facility in Mobile, and her life was saved. Today, she got 2 children, active family here in our community, business owners in our community, and that's just one example. If she had had that last month while this hospital was closed, she would have died.
I'm sorry to ask this, but how many members of your community do you think you may have lost because of this?
It's hard to tell. We've done the best we could do.
Mayor Day has given dozens of tours to prospective buyers and media over the last couple of years, trying to get the hospital reopened. But the financial headwinds facing rural healthcare in the U.S. are made up of more than just the lingering impact of COVID. And those headwinds are getting more intense because of recent federal policy decisions, cuts to Medicaid, increased work requirements, disappearing subsidies. In Alabama, the State Hospital Association says more than 80% of rural hospitals are operating at a loss.
Many of the buyers that looked at the facility, they absolutely were foaming at the mouth to buy it, and then they go work the numbers and they go, I don't think we're going to do it.
In a moment, we'll hear more about the town's efforts to get the hospital up and running again.
Marketplace Morning Report is supported by Barron's Investor Circle, offering stock picks, market insights, and access to the Barron's editors behind a century of reporting at barrons.com/investor circle. And by Palo Alto Networks. Palo Alto Networks delivers what's next in cybersecurity innovation to protect today's digital way of life. Learn more at paloaltonetworks.com.
Let's return now to Alabama. Despite the tough math facing rural hospitals everywhere, Mayor Day does have a solid sales pitch.
It's ready to go. I mean, that's one thing I think that is attractive to people who are looking and considering purchasing the facility here.
Everything is so new. I see the hand sanitizers and soap is still stocked.
They've put probably in the neighborhood of about $100,000 a month to maintain the facilities.
Plus, the hospital is a bargain. The mayor says the price tag is around a fifth of what it would cost to build and open a similar facility today, about $12 million instead of something like $60 million. But Thomasville is being very careful about finding the right buyer.
There are a lot of folks going around, basically bottom feeders, trying to, collect up a bunch of rural hospitals, and many of them are buying them, converting them to rural emergency hospitals, which they get a better reimbursement, but you do not have the same level of care.
And reopening also means rehiring. The mayor says more than 100 jobs were lost when the hospital closed.
Many of the folks who were here want to come back. We talked about the other facilities in our area beginning to convert to rural emergency hospital, where that means they're not doing med-surg anymore. Some of those nurses will want to come here. We had people that worked here for 3 weeks without a salary because they wanted to make a difference here.
And the need clearly remains. The facilities manager told us sometimes people still drive up to the hospital during emergencies before the signs on the locked doors to the ER inform them they have to take their crisis somewhere else.
Anywhere I go, the number one question is, tell me about the hospital, any progress. The multiple stories that I have are people who, hey, we're thinking about moving back home, but we need health care for mama. Or just recently had a minister in our community where her husband has a lot of health issues. And the number one reason they're leaving is because they got to have access to a higher level of care for him.
Over the next week, we're going to share more about how changes in federal policy show up in rural health care and what that means for the economy wherever you are. You can follow our coverage through our Marketplace Morning Report podcast or on marketplace.org. I'm Kimberly Adams with the Marketplace Morning Report. From APM, American Public Media.